Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. Express Scripts said last week that it's looking for retail partners to fight diabetes. Unlike its rival, CVS Health, the nation's largest pharmacy benefits manager doesn't have its own network of retail clinics, but it wants to change that by next year. Express Scripts Chief Medical Officer, Dr. Steve Miller, told a meeting of the PBM's largest clients that it's working to create partnerships with existing retail outlets because that's what consumers want. Said Dr. Steve Miller, "Right now, consumers don't differentiate and don't prefer retailers based on their quality. It's usually just a cost equation. We think this is going to be huge in the marketplace because you're going to be able to get millions of patients higher quality care and lower cost on diabetes." For more on the growth of retail clinics in diabetes care, see our recent coverage from our conference, Patient-Centered Diabetes Care, at ajmc.com. A new study in JAMA Oncology found that oral agents to fight cancer are being launched at much higher prices compared with a decade ago, and this can affect patient access to care. Claims data from Truven Health MarketScan showed that the cost of oral agents approved in the year 2000 were $1,869 per month, but by 2014, the cost for new drugs had climbed to $11,325 per month. Older drugs, such as Gleevec, are becoming more costly as well. Between 2001 and 2014, the price increased from $3,346 to $8,479 per month. Dr. Peter Bach of Memorial Sloan Kettering Cancer Center said, "The rate of rise exceeds the health benefits from these drugs. This is a ginned-up pricing structure that isn't a product of careful analysis. For cancer patients and others with serious illness, the sooner palliative care starts, the better." Dr. Toby Campbell of the University of Wisconsin told AJMC recently how early palliative care leads to better outcomes.
Palliative care ideally comes up pretty early, actually. We know from the research that the earlier we talk about integrating palliative care into the management of an individual and their family's cancer care, the better the outcomes are. So when we see improved symptom management, when we see improved adherence to advanced care planning and goals of care, when we see people live longer, that's when we've brought it up early.
1 in 5 Americans has a family member addicted to prescription pain medication, a new poll has found. The Kaiser Health Tracking Poll, taken in mid-April, found that 4 in 10 Americans knew someone addicted to opioids, and that most Americans thought both the federal government and their states were not doing enough to combat the epidemic. While those who responded to the poll placed the greatest responsibility for the problem on addicts themselves, nearly 2/3 also said physicians bear responsibility for prescribing too many painkillers. The CDC recently issued new guidelines to help primary care physicians reduce the number of painkiller prescriptions, which had increased 7.3% per person between 2007 and 2012. This week, the American Journal of Managed Care published a special issue of new research and commentary on treatment for hepatitis C, which discusses both the long-term health benefits and cost-effectiveness of this new class of therapy. Edited by Dr. Jay Bhattacharya of Stanford University, the issue presents evidence for payers who are trying to address what Bhattacharya calls the dismal arithmetic of HCV care. He wrote, "Although the medical prospects facing patients with hepatitis C virus have never been better, the prospect of gaining access to a cure is another matter for many patients." For the full issue, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.